Carter, a nurse and executive vice president of ThinkSafe and the First Voice products. It was based on my experiences that led us to develop a product that would assist those first responders in a medical emergency. Based on my personal experiences as a flight nurse, we started to notice that people were not always prepared to deal with an emergency. There's some chaos that goes on, there's the fear of being able to do the right thing, there's a whole lot of dynamics going on, and no emergency is ever the same. In the medical profession, we have what's called a golden hour of trauma. This is so crucial to someone responding to an emergency. And what this tells you is, from the time of the incident or injury till the time we get to the hospital, if it's within the golden hour, that improves the potential for survival for the injured party. So what I want to tell you is that first person is just as important as that surgeon, physician, or emergency room staff that end up being at the receiving end of it. Preparedness be put in place for bloodborne pathogen training, CPR training, and AED training. But what we found was missing is medical emergency training, trauma training, all of the things that you need in place to deal with a true medical emergency. Voice unit, you can see we've color-coded and numbered and individualized the packets of supplies. So all you have to do is push a button relevant to your medical emergency and pull the supply bag off with the same color and name of the emergency, and now you have the information you need to deal with the emergency and the supplies you need to use for it. Published policies from the Heart Association, Red Cross, and the National Safety Council and put them into a system that delivers the information to you at the time of the emergency. The system involves a voice unit that's color-coded that you are able to push yes/no prompts to get you to the exact emergency that you're experiencing. In addition to that, we've organized your supplies, and we put your supplies in a manner that is color-coded with the voice unit, so you have exactly the supplies you need to deal with that emergency. So as a flight nurse, obviously our supplies had to be very concise, very orderly, and be very accessible. In addition to that, we flew flight nurse and a paramedic. So there would be conversation going between us as we were dealing with the emergency. And what we're bringing to the first responder is that same kind of concept, only in a voice unit. So what we've done is we put it so you have it accessible to you at the site, so you, so to speak, have your paramedic that you're talking to as it's guiding you through anything you might be doing. Second of all, you have a tool to train on, and safety managers are taking this to their monthly training program and actually having their staff practice on whatever emergency is the topic of that month. And the third thing that I believe really makes it concrete is our online training. And the online training is scenario based, so it allows you to practice on emergencies and be able to deliver the appropriate care just based on repetition and training. On some of my personal experiences, there was hesitancy in doing CPR, and part of that hesitancy was because they were afraid they were going to do it wrong. So what we've done is we put the voice unit that actually counts out for you what you need to do to perform CPR. I also experienced some confusion with some people on how to deal with a chemical, thermal, or electrical burn. And what we help you do is determine what the appropriate care is for each of those type of individual burns. Sometimes it's not always about trauma, it's about early recognition of a medical emergency. That could include a heart attack or stroke. And now we have medical technology that allows us to actually reverse those symptoms if they are seen in a definitive time. So what your job is to recognize those symptoms. And what our voice unit does is it helps you recognize those symptoms. And again, not all of this is related to a workplace injury. So being able to understand what a detached retina symptom is, if someone comes to you as the safety team or a safety director and describes to you symptoms of that, this allows you to understand that this could be a medical emergency and it does need to have definitive medical care. In conclusion, the First Voice product provides you with voice-assisted first aid, the prepackaged supplies, the availability to train on the product at any time, and the web-based online training that gives you different scenarios so you can work through different situations and understand what you need to do to intervene. When you're in a medical emergency, I can guarantee you there will be chaos, confusion, and there'll be a whole disruption of sorts. So the product is there to empower your staff to work through this emergency and do the right thing.